problems right now than supporting your comedy music!
Seth MacFarlane's classics are a staple on this channel. That's why today we are learning about and reacting to one of your favorites, American Dad. This show is hilarious. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
You can't hold that pose forever.
Nice.
Can never quit.
Oh, the vein.
Bane, gross! And the judges love it.
I'm absolutely losing my mind here.
You can work the muscle actually really well, so you're actually increasing the need for blood and oxygen to get to the tissue. Veins could potentially grow, but again, over a longer period of time. Oh, whoa! An aneurysm has a softening, basically, spot within the blood vessel in an artery typically, and it can rupture and then you just have bleeding. What ends up also happening is you can have what's called a AV malformation or different types of fistulas that could also cause bleeding in the head. So let's see what happens.
Francine's extreme exertion during the competition caused her to have an aneurysm.
There you go. So the issue ends up being, what is that bleeding doing and how much is it expanding? Is the person on a blood thinner or not? These are all factors, and what's happening is it's a confined space. The more blood in the brain, the more the brain gets compressed and is trying to escape out. Sometimes a neurosurgeon needs to come in and do a burr hole where they drill a hole through your skull to relieve pressure. These things are done emergently, sometimes right in the emergency department.
She's in a coma.
This is totally my fault. If only I hadn't strong-armed my way into that bodybuilding competition.
Stan, snap out of it! Yeah!
So you can see that there's a little bit of anger going on. Most likely it's related to steroids, and then we've all heard it's called steroid rage, where it's just messing with your hormones and people just go nuts.
These machines are keeping her alive.
You guys on drugs?
Very much.
Yes, an incredible amount. Yes.
Yeah, that's not good.
She's unresponsive.
What the doctor is doing is shining a light. You're looking for a pupillary reflex. So when the doctor shines a light, you're looking to see if the pupils contract. When you go into an area that's fully lit, your pupils shrink to decrease the amount of light that's coming in. And if you're in a dark area, they dilate. Medications can change this as well, but it also has to do with basically basic brain function. So if that's not occurring, the person probably is either brain dead or is on potentially a different type of medication.
I'm a man, Francine. From my head down to my low-hanging...
Oh, right into his grapes.
Stan, are you okay?
You actually got to be careful. You can actually seriously injure them, bruise them. Probably not as easy to rupture them. They're more of a solid organ, but you can cause inflammation, something called orchitis, or you can cause inflammation of the epididymis, which is around it. There's always a possibility that the rake actually goes through your shoe and punctures the bottom of your foot too. Oh my God, what is this?
Okay, I'll bite. What's up with the gyroscope on his junk?
Stan was injured
I love that they call that a gyroscope. It's awesome.
and went into a rare condition known as testicular retreat syndrome. His, nugs were so traumatized, they ran up into his body to heal.
Testicular retreat syndrome. I've never heard of this before. Yes, testicles can retract up when we're being made inside of our mothers. Testicles are inside of our abdomen and they actually descend out through the different canal to go outside of our body. So sometimes people have undescended testicles. And so what ends up happening is sometimes they need to be surgically taken down. The opposite typically doesn't happen.
They might drop down again someday, but the doctors say there's a good chance they'll just die up there.
What? You can actually live without your testicles, but hopefully he doesn't. If you don't have your testicles due to trauma, cancer, weren't born with them, you can live a full, fulfilling, sexually active life. You may have a little bit of difficulty procreating, but there's always means around that as well.
Why the hell didn't you dicks show up to our balalaika concert? I've got bigger problems right now than supporting your comedy music.
It's definitely not real, but sometimes it might feel like you need to speak in high pitch because it hurts so bad. Whoa, satellite just fell on him.
A shooting star just hit the house. Everybody make a wish.
Is everybody
Oh
candy?
my gosh.
With several months of physical therapy, your body should fully return to normal.
You basically don't ever put somebody in a mummy outfit. In a hospital, it's usually a splint because if you put something in a cast, it's all the way around and you're still having swelling and you can actually swell into the cast itself. Versus if you just have a splint, it allows the body to swell in that specific area.
Of course, you'll never walk again.
What?
What?
Of course he'll walk again.
Big maybe.
It's told that he can't walk. Like, okay, sometimes doctors may say that to motivate somebody if they know them well. But sometimes if you say they can't walk, people will actually believe it and manifest it to where they won't walk.
I sincerely want you to get better.
What? This is awkward.
Now, if you'll excuse me, this bird's gotta fly.
What? Hopefully, doctors don't kill themselves, but lately there have been an uptake in suicides among physicians. Suicides affect all professionals, all walks of life. If anybody is feeling suicidal, there's always phone numbers to call. There's always hotlines. Even just reach out, leave messages. People will be there to help.
What the hell was that?
I'm not hurt.
I think you're still on top of it. Back.
No! Oh!
Oh my God, I hit Francine!
Francine.
We should probably leave a note.
I can't tell you the amount of times I've treated somebody in the last few years that has been hit by a car. It's like astronomical. We need to watch each other's back, drivers and pedestrians.
Hello, I'm Dr. Gupta.
Is my wife gonna be okay?
Really? Because the way you're looking at me, it seems like you're concerned with something else.
What? What the heck?
There. Now can we move on?
Oh my gosh. This doctor has a weird bedside manner. When you actually go through your training in medical school and residency, you're actually like taught basics of bedside manner.
When you ran over your wife, it caused her brain to detach from her central nervous system.
So her brain detaching from the central nervous system. That's almost like the brain is just not functioning anymore. I'm assuming is what they're trying to get at.
She's what we in the medical profession call a husk.
I've heard of that.
Well, there's no medical term that we use as husk. She's still got a heartbeat. She's still beating. The question is, neurologically, where does she stand?
We can reattach her brain, but it's an experimental procedure your insurance won't cover.
A lot of times when somebody has neurologic injuries, you actually need a little bit of time, a couple days at least, to let things kind of sit in and see where they end up, because inflammation can cause things to be worse, and you can give medications to decrease inflammation. Unless there's like a complete sever of like the spinal cord and there's no repairing it, that's a different story.
That's my wife. I don't care how much it is, I'll pay it.
It's $178,000.
What if I don't need her to talk?
I performed the surgery.
Sometimes when a procedure costs a lot of money, you can actually negotiate at times the cost to come down. Clinics and doctors' offices that also do income-based payments, that sort of thing. So there are options out there.
Once again, great job on that surgery.
Yeah, it was touch and go there for a while, but all's well that ends well.
All right, we're at rehab.
That's right.
Almost behaving as if she's had a stroke versus reattaching her brain.
Safety first. Now let her rip.
Oh my gosh, this is a bad situation. What?
Oh, luckily it's only a minor injury.
What the heck was that? Why would you put that piece of wood on your lap?
Minor? I doubt we'd be calling it minor if it was your wee-wee.
Why is he continuing to get like traumatized to his genital areas? Now the question ends up being, was it punctured? Was it burned? Let's find out.
Finally, the burn ointment.
Ah, burns. The damage is already done, so now you just want to cause pain relief, which you can use pain medication, anti-inflammatories. And really the only creams or meds that we put on topically is ointments to keep the tissue like moist, so it's hydrated. And then if the skin opens up from like a 2nd degree burn where the blister opens up, maybe an antibiotic ointment to prevent it from being infected.
Smith, I'm elbow deep inside the vice president's chest. This better be important.
Vital. How do you use ointment?
Oh, just take a large gob and apply it directly to the affected area.
Oh, okay, but the affected area is my,
Doctor, the aorta has ruptured.
Clamp onto it with both hands.
Okay, but to do that, I'm gonna have to put you on speakerphone.
Doctor, the artery is retracting.
Pull on it. Pull with
Oh
all
my
your might.
gosh.
I feel weird. Maybe I should stop.
The doctor is trying to talk to his nurse or his scrub tech to be able to stop the bleeding. You should probably clamp that aorta so you're not bleeding out. And it's retracting because it's a muscle. Let's see where this goes.
Don't quit on me now, you son of a bitch. Keep pumping.
But I'm...
Oh, it's gotta be painful. And it's gonna change, basically it's erectile tissue, so it's gonna change in size during the day and nighttime because you get nocturnal erections. That's normal. It's gonna be extremely painful as the skin stretches. These are hilarious. I love the American Dad series. We can all even learn something even though they're quite entertaining. Do you have a favorite TV show or movie that features medical situations that you want me to break down further and explain? Let me know which show or episodes in the comments below, or if I missed any American Dad scenes that I should check out for another video. As always, make sure you subscribe if you want to see more fun videos like this one, and check out my Doctor Reaction series right here to catch up on all the reviews of your favorite shows. Thank you so much for watching, and stay healthy, my friends.